Right. Hi everyone, welcome to today's COVID-19 update for Yakima County. My name is Jocelyn Castillo, Community Health Specialist at the Yakima Health District. Joining me today are our Emergency Response Coordinator, Nathan Johnson, and Environmental Health Director, Sean McGee. Thank you both for joining us today. And they'll be providing information on the COVID-19 vaccine and the new reopening guidelines in just a moment. To start off, as usual, I'll go over our current cases. As of 4 p.m. today, we've reached a total of 24,401 cases of COVID-19. We have 334 deaths related to COVID-19, and there are currently 46 individuals who are hospitalized due to COVID-19. Three of them are currently intubated. Some good news is that here in Yakima County, we are seeing a downward trend in COVID-19 cases. Thankfully, we have also passed the peak in new cases that we expected to see after Christmas and New Year's. And so I hope that good news encourages some of you to continue following the recommended guidelines, and that it will also continue help you stay motivated as we move into distributing more vaccines to the community. To start off, Nathan will be providing a brief update on how those distribution efforts are going here in Yakima County. Go ahead, Nathan.
All right, thank you, Jocelyn. Yeah, so I first want to touch on, we know the governor's announcement yesterday with the idea of putting up these large mass vaccination clinics throughout the country. There's going to be 5 of them. The 2 closest ones to Yakima will be Wenatchee and Benton Franklin. And I think it's important for the community to know that that does not mean that there's going to be no opportunity to receive the vaccine in our county. That is just where the state resources are going. We locally are continuing planning with our community partners on finding ways to ensure that that vaccine is accessible to everyone, and there's no barriers involved. It's a nice, easy process for anyone in the phase that we're in to be able to get that vaccine. Right now, we're working very closely with our federally qualified medical centers, our hospital systems, and other pharmacies and medical clinics who have started receiving the vaccine. We are following suit with the state, so we are moving into also expanding to phase 1B tier 1. So that is, again, the 65 or older, and also 50 or older if you're in a multi-generational family. So those, we're expanding to that, but that doesn't mean that if you're a 1A and haven't got the vaccine that you can't get it. You certainly still have opportunities to get it. There's 2 locations you can look to find where to find the vaccine. There's the findyourphasewa.org, which is a State Department of Health operated website where it will tell you what phase you're in, and is a very helpful tool. However, we strongly recommend always looking at the Yakima Health District's website as we have the most up-to-date and current information on where you could get the vaccine and the bigger portion of how to schedule an appointment. A lot of our partners who are administering the vaccine are no longer, or they're not doing any walk-in clinics. At this point in time, it's scheduling ahead of time. We certainly do not want long lines to form in front of all of our clinics or our hospital systems in front of the ER doors. We want to be able to have that vaccine available and accessible, but we don't want to impede the healthcare system. So going forward, again, we continue to coordinate with our partners. We're looking at different ways to have different access points for the vaccine, very similar to how we worked with our testing. We are working on ironing out the details on what exactly that looks like. We're also working to get enough vaccine to also support those efforts as well. So once we do have that plan in place and we get the vaccine, it's a smooth rollout. As of this morning, we've received 9,405 first doses of the vaccine. That's a mixture between the Pfizer and the Moderna. Of that, 6,197 doses have been administered. We've also received an additional 3,533 booster doses. That's the second dose of the vaccine. And of that, 1,515 doses have been administered. At this point in time, the state receives weekly vaccine allocations. And once it's sent to the state, then the state allocates that out to each county and each organization. So we know we're still in a time where we have very limited supply of the vaccine. Just because an organization receives the vaccine one week doesn't mean they're going to receive the vaccine the next week. So again, always be looking at our website because that's a live list of who has the vaccine and how to schedule, which is definitely a really good tool to have. From that, I will say the biggest thing is patience. I know it's a lot to ask for. We want to get this vaccine out to the community as soon as we can, but we also need to get that vaccine into our county as well. And until the supply chain catches up with the supply and demand of the vaccine, we're going to be getting limited quantities, not only in the state, but in the county. And we will continue to work with our partners to get that available to the community as quickly as we can. Just a couple things. I know we're now doing this a recording, not the Facebook Live like we intended, but I did see just a couple questions on our Facebook post that I wanted to address. One was, can educational or other service providers to persons in 1B2 count as persons within that category? At this point in time, it's anyone qualifying in phase 1A or 1B tier 1. So regardless of if you're a teacher or work at an auto body shop, if you meet those criteria of being 70 or older or a 50 or older in a multi-generational family or one of our healthcare workers or first responders, at this point in time, the vaccine is available. Again, the biggest thing is you got to schedule that appointment and realize that you might not be able to schedule that appointment for later on today or tomorrow. So just again, patience with our healthcare providers. Another one is, does YHD have an idea of how long it will take to distribute these vaccines to all these categories? It's going to take several months, to be very honest. Again, until the supply catches up with the supply and demand, it's going to take a while for us to get that vaccine into the community and then furthermore distributed throughout the community. And then there was a good question about what's the plan to distribute with farm workers. That's something that we're actively working on. We know that agriculture makes up a large population of our county and our workforce, and we want to do everything we can to protect that workforce, protect our essential employees. And again, it's all about making accessible access to the vaccine and not having barriers in between, and really making it a streamlined process for our community. And it's going to take some time, but we're very committed, and we have great community partners. Our FQHCs, our medical clinics, our hospitals are really stepping up to the plate and doing everything they can to administer that vaccine. And we're going to continue making that process better and more streamlined and providing more opportunities for the public.
All right, thank you, Nathan, for that update and for answering those important questions from the community. Before we move on to Sean, I just want to remind everyone that all of our COVID-19 vaccine information is available here on this webpage. So there's more information too on who's eligible under the multi-generational household category. We know that many of you have questions whether you meet this category or not, and you can just go to our website and read the criteria there to determine if you are eligible or not. Also, all the current vaccine locations are listed on this website. And as Nathan mentioned, please note that all of these locations have phone numbers or other contact information. So please call ahead of time. We ask that community members do not visit a location without making an appointment first. So now we'll move on to Sean. We still have received questions about the new reopening guidelines. Do you want to give a brief update on where we are at with that?
Jocelyn, do you want to stop sharing your screen, please?
Yeah.
Great, thank you.
Yes, I apologize. I have to switch rooms as my my son is being loud. Okay. Apologize for that. Okay, so update on the business side of things for COVID and our roadmap to recovery, where we're at, what's happening, all that stuff. We recently entered into the Healthy Washington Roadmap to Recovery. The entire state has been broken up into regions. Yakima County is in the South Central region, along with Kittitas County, Benton Franklin counties, Columbia, and Walla Walla. We are still in phase one. We got some more data late last week about how we're doing. For the 4 metrics, which I'll go through those real quick. The metrics are there needs to be a decreasing 14-day trend of more than 10%. There needs to be a decreasing trend of more than 10% in new COVID hospitalizations per 100,000 over a 14-day period. There also needs to be 7-day occupancy of staffed ICU beds need to be under 90%. And the last metric is 7-day test positivity rate under 10%. So for the South Central as a region, we are, for metric number 1, 14-day rate of new COVID cases per 100,000. We saw a decrease in 12%. So we are meeting that metric currently compared to the last 2 weeks. For new hospitalizations, there was a decreasing trend of 22%. So as a region, we are meeting that metric. For the 7-day occupancy of ICU beds, we're at 91%. So we're getting closer to meeting that metric. We need to drop 2% more to technically be meeting the metric for ICU beds. And our 7-day positivity rate as a region was at 19%. So we got a little ways to go in our test positivity rate, but it was down from the previous 2-week cycle. I believe we were at 22 or 23%. So we are dropping, which is good news. So we remain in phase 1. Along with this new roadmap to recovery, there was some guidance I want to talk about that we've noticed some confusion around the open air structures for dining at food establishments, restaurants, bars, taverns, wineries, etc. What this document shows us or tells us is how a facility can utilize its space in alternative ways to just normal outdoor dining. And here it is, I got to reference this. So what a lot of restaurants and other food establishments are thinking is that indoor dining is allowed at 25% occupancy as long as we can keep our entrance and exit doors open. That is not the case. Indoor dining is still not allowed in phase 1. It is outdoor dining only in open air structures. So I want to talk quickly about what qualifies as an open air structure. So the open air concept 1 is defined as follows. The seating area has 2 or more adjacent non-permeable walls. Occupancy limited to 25% of the seating area as set by fire code. This does not include employees. So what they're talking about here is if you have a structure that has 4 walls, one of those walls must be defined as permeable. Also in the definition of permeable, a normal entrance or exit door does not count towards the permeability of a wall. It needs to be the way I understand it, and as it reads, 50% of the wall needs to be permeable with open windows or a large garage or bay door. So if you have a four wall structure and on one of those walls you have two large bay doors that you can open it up and keep the fresh air flowing through that structure, you may do that, but you have to have CO2 or carbon dioxide monitoring or monitoring devices showing carbon dioxide part per million levels at all times, which the requirement is to be below 450 parts per million at any point. And if you are 450 parts per million or above for 15 or more minutes, people utilizing that space for dining must be moved to a different open air structure or direct outdoor dining. That 450 parts per million is the threshold for ambient outdoor carbon dioxide levels, which are about 400 parts per million. So we have about 50 part per million buffer for these open air structures to work with. So concept number 2 is 1, 2, or 3 walls are permeable with multiple fully open windows or bay doors. That's just the definition. I'm sorry about that. Concept number 2 is structures have 2 non-adjacent permeable walls, unblocked walls that allow cross ventilation, must have CO2 monitoring in areas with no direct path, not within direct path of air. So what this is talking about again is a potential 4-wall structure. You have, let's say on the east wall, you have 2 large bay doors. On the west wall, you have a bunch of exterior windows that can be opened to allow cross ventilation. That is allowed, and you can use that at 25% occupancy set by fire code. Now, the areas that don't fall in the direct path of those openings in that building, which is being defined as the path of air to travel and cross ventilate, there needs to be CO2 monitors in those, for lack of a better term, stagnant areas. So there's that. So those are the 2 concepts that have really led to some confusion around whether indoor dining is allowed or not. This is not considered indoor dining. This is considered open air structures for dining. So it may be in an indoor setting, but we're allowing enough air turnover to keep the carbon dioxide levels down, which is the measuring stick for knowing that we're diluting and getting rid of any droplets people are exhaling while they're sitting there eating their food. So I just wanted to clarify the guidance on open air structures and that indoor dining is not open until phase 2 at 25% occupancy. And that's my update on the open air structures and dining for food establishments.
Okay.
Do we have any questions come in from that?
No, I don't believe so, not on that. So thank you, Sean, for that update. If restaurants do have questions, do you know what number they should call?
Yes, for restaurants, they can call our main line, which is the 575-4040, or they can call our environmental health help desk at 509-249-6508. And an environmental health staff member will get back to you and answer any questions you might have. So those are the best ways to contact us if you'd like to call.
All right, thank you, Sean. So that's all we have for today's update. We did intend to have this update live on our Facebook, but due to technical difficulties, we were unable to do that. So now we'll just upload this onto YouTube and share it on to our social media. If you have questions that you would like us to answer for the next update, please leave them in the comment section below of this post. Thank you all for watching. See you next week.